Hi, my name is Rochelle Franklin. I'm going to be performing the deep tendon reflex skills video today. And first off, I'm going to introduce myself to my patient. Hi, my name is Rochelle Franklin. I'm going to be your nurse today. Can you verify your full name and date of birth, please?
Yes, Jacqueline Brown, November 3rd, 1966.
Thank you so much. Now we're going to perform hand hygiene and, of course, provide privacy to our patient. So for deep tendon reflexes, it's important for us to evaluate this as there is a lower motor neurons and fibers that are specific to each level of the body, upper and lower. And with deep tendon reflexes, it's important for us to check in pregnant women as we're assessing for clonius or hyperreflexation. With that being said, deep tendon reflexes, if we are seeing the hyperreflexation or clonius, that's an indication of hypertension, preeclampsia, and also patients who receive magnesium sulfate or an electrolyte imbalance that is diminishing your deep tendon reflexes or causing them to overreact. Okay. So there is a scale that's grading for the deep tendon reflexes. That's going to be a 4+ is a hyperreflexation, or also known as clonius. That's the one we worry about the most. 3+, which is a brisk and more than normal, that's also going to be considered hyperreflexation, and a 2+, which is normal. So if you hear me say 2+, we're all good. And then 1+, which is a diminished or hyporeflexation, and of course a 0, which is going to be an absence of the reflex. All right, and then we're going to start off with our bicep, okay? So I'm going to grab my hammer. I'm going to have my patient go ahead and flex for me. All right, and then relax the hand. So this one that we're looking for is the bicep deep tendon reflex, and how we're checking for C5 through C6. So it's going to be below the bicep muscle, which I see right here and feel, in the antecubital fossa, and we're going to flex the arm like I said to her, and we're going to find that tendon. It's going to feel like a cord. And then with our thumb, we're going to feel for a contraction, and then we're also going to see once we kind of hit that reflex with the hammer, we're going to see a contraction in the bicep and maybe a flexion in the forearm. So we're going to take our hammer, and it's about 2 finger widths, so it's what I felt from the antecubital fossa, and we're going to support underneath. So I'm going to kind of have it like that. And perfect. I saw a slight flexion, so not too much and not too little, so that's going to be a 2+ for you, okay? And we're also still supporting our joint as well. This one is going to check for your tricep, okay? So we're looking for C7 through C8 to find the tricep tendon. We're going to feel above the elbow. And then for this one, we're supporting, of course, and letting our patient dangle their hand down. And we're going to have an extension of our forearm, and that's going to be slight as well. So we're going to use our hammer, and I did see a slight movement. That's going to be a 2+ as well. Next up, we're going to do the brachioradial. So with this one, we're looking for C5 through C6 as well. To find this tendon, we're going to have the radius and the styloid process, which is kind of like the little bump that we feel. And we're going to lay it across the leg. And I'm just going to double check that you can see what I'm doing here. Lay it across the leg, kind of dangling the hand a little bit, and we're going to find that tendon. It's about 2 to 3 centimeters above the wrist, and then we're resting the hand on the leg as I mentioned before, and then we're going to look for our forearm and kind of fingers and hand to kind of move upward, up and out. So where my fingers are. Perfect. And I saw a slight movement up and out, and that will be a 2+ as well. next up, we're going to do your patella, okay? So I'm going to have you dangle your leg for me. And I'm going to move the camera just so that we can see that a little bit better. Okay, so we're going to dangle, and we're looking for the patella. It feels like a slidey bone right on top of the knee. And this one we're looking for L2, L4, and it's located right below the knee with the patient sitting and dangling their foot. And we're going to support the back of their knee, okay? And then what we're looking for is for a leg extension outward. And we'll do that. Perfect. And it was slight. We're going to call that a normal 2+. And then for the Achilles, I'm going to move it just a little bit more. All right, let's move you. So for the Achilles, I'm going to have her flex, dorsiflex towards her forehead. And then what we're finding here is L5 through S2, and we're feeling it right above the heel, and we're looking for that cord-like feeling. I feel it now. You can go ahead and relax. And she's helping me out, and she's supporting her own back of her knee, so I appreciate that. Thank you so much. And perfect. And we're looking for the foot to kind of move upward, or excuse me, downward towards the floor for a flexion, of course. And then go ahead and flex again. All right. And this one, we're looking for clonius, which is a muscle spasm. It's rhythmic, and I'm not feeling it at all. It's going to feel like a pulsating, indicating that there's a nerve condition that is affecting the nerve cells that control the muscle. And that is dangerous because it, like we mentioned before, the electrolyte imbalance can cause some seizures and other concerns that we would report to the provider. All right, well, congratulations. Thank you so much for helping me. I'm going to go ahead and hand hygiene and report to the doctor. Thank you so much.